have a fibroid and you are trying to get pregnant. What is this? What does this mean when you have a fibroid and you are trying to get pregnant? In this video today, we are going to talk about how you can get pregnant even if you have a fibroid. Mu video ya fene ya lero tugenda kwogera ku butya osobola okubanga ofuna olubuto wadde nga obadde olina ekizimba kye tuyita fibroid. You have done the ultrasound scan and your doctor has told you that you have a fibroid, and you are asking yourself, how are you going to get pregnant? Fibroids are swellings which actually develop inside your womb. Fibroids oba ebizimba bye tuyise ebigalanga bye bino ebikola mu nabana y'omukyala ate ogenda okulabanga ekiro okubireeta normally biva ku bintu nga hormones is what is balancing. Many times these fibroids can develop when your hormones are not balancing. When we talk about hormones specifically, we are talking about those things someone is born with, a woman is born with these chemicals. They are called hormones, and specifically we are talking about two hormones. The first one is what we call progesterone, and then the next one is what we call estrogen. Now, progesterone specifically is a hormone which we call a pregnancy-friendly hormone. It's a hormone which actually makes the wall of your womb, it makes the lining of your womb to thicken so that when the egg attaches and it implants onto your wall, then the baby or the fertilized egg is going to grow for a period of 40 weeks, which is actually 9 months. If this hormone, progesterone, is low, then there are high chances that fertilization can take place. The egg comes and it attaches itself onto the wall of your womb, but this does not grow. It actually ends up into a miscarriage. The main reason is because of the low progesterone hormonal levels. Now, progesterone has no effects on fibroids, but if at all you actually do not get pregnant, you are in your reproductive years and then you do not get pregnant, there's going to be a rise of the hormone known as estrogen. Now, estrogen levels rising, it's actually connected, it correlates with fibroids developing into your womb. So we are looking at how can you get pregnant even if you have fibroids. How can you get pregnant even if you have fibroids? If you have done the ultrasound scan and it has shown that you actually have fibroids, what you need to do specifically is you actually need to see your gynecologist who will put you on treatment. The treatment we are talking about specifically looks at stabilizing your hormonal levels. Now that is when your fibroids are below 50 millimeters. Let me answer all your questions about fibroids, about how you can get pregnant if you have been trying to get pregnant. Obanga obadde ogezaako okubanga ofuna olubuto naye nga bikyakulemeredde, gezaako okulabanga ombuuza, nja kuba nkuddamu ebibuuzo byonna byonna. You can give me a call right now and then I will answer all your questions about fibroids. Consultation fee is it's very affordable. Give me a call and then we shall talk about it. Have yourself a great and fantastic day. Let me see you in my next video tomorrow. Bye-bye. Different gender prediction tests. Are you trying to identify or are you trying to determine the gender of your growing baby in the womb? You are pregnant, you would like to know whether you are carrying a baby boy or a baby girl. In this video today, we are going to discuss the different gender prediction tests. Stay with me up to the end of this video, and by the end of this video you'll be able to know how to do a gender prediction test. Gerald Massa, the health educator, is the name of the channel. Remember to subscribe so that you do not miss new videos I release every day about fertility and reproductive health. Gwe atuyenzeko leero tugenda kwogera ku kye tuyise gender prediction test. Osobola otya okumanya oba oli lubuto lwa mwana muwala oba lwa mwana mulenzi? Bino bye tugenda okwogerako mu video yaffe eya leero. Nyiga epeesi ya red oleme okumisinga videos zetuteekayo buli kanako. Gender prediction tests. There are many gender prediction tests on the market. There are many gender prediction tests out there that have been discussed many times. For example, the Chinese gender prediction test, the Drano gender prediction test, the hairline or the hairstyle gender prediction test, which basically looks at how the hair is distributed along the head of the growing baby. But what I'm going to emphasize is that the best way to determine your gender, the gender of the baby, is by doing an ultrasound scan. Obanga obadde oli kwebuuza butya osobola okubanga omanya oba ostudde oba ogenda kuzaala mwana muwala oba mwana mulenzi, olina okubanga okola kye tuyita an ultrasound scan. Eba esobola okulaga ekifaananyi kituufu kiki kyennyini ekigenda mu maaso. If you do an ultrasound scan, chances are your doctor will actually be able to visualize, or your doctor will be able to see images of the growing baby. And actually, with good ultrasound scan machines, the gender of the growing baby will be very, very visible. But there are many factors which could limit this. Obanga obadde okoze scan, waliwo bintu bingi ebisobola okubanga biremesa gender y'omwana okubanga erabika. The factors that could interfere with the results of the gender prediction tests through ultrasound scan is when a woman is very fat, or when a pregnant mother is obese. There are high chances that due to the high amounts of the fatty tissue along the abdominal wall, the ultrasound scan waves may not be very, very able to penetrate through the fat layer, and therefore the resulting image may not be very clear. In women who are pregnant and they have lots of gas in their abdomen, there are high chances that the results may actually not be very clear, because too much gas distorts the sound waves. The images are distorted due to the gassy shadows. Obanga obadde okoze scan naye ate newezola nti obadde oli lubuto, oli mukyala munene, oli lubuto, olina gaasi mungi, oli lubuto olina amasavu mangi oba olina esavu lingi ery'oku lubuto, kyangu nnyo okubanga results za scan ziraga nti kwegamba teziri very clear. So if you are looking at doing a gender prediction test, make sure that you actually do what we call a pelvic ultrasound scan. But according to law, it's not allowed for your doctor to actually disclose the gender of the growing baby, although you can discuss this with your doctor in the consultation room or in the room where they are doing the procedure, the ultrasound scan. Your doctor can see something and they will tell you, but according to law, it's not allowed for you to actually it's not allowed to officially document the gender of the growing baby. Depending on the country you are from, the different laws apply. So maybe in your country they allow to disclose the gender of the growing baby, but in some countries like India, the law is very strict. The doctor doing the ultrasound scan is not supposed to talk about the gender. They're supposed to talk about other parameters, for example, the position of the baby, whether the growing baby has enough or sufficient amniotic fluid, whether the heartbeat is normal. So they're supposed to talk about other parameters, but the gender, it is actually not allowed in many countries. Obango badde olikwebuuza kulwaki musawo aganya okubuulira sex ey'omwana oba gender ey'omwana, kyandibadde kirungi okumanya nti ensi ezimu tezikiriza ng'eteeka, tezikiriza okubanga dokita wo akubuulira gender ey'omwana. So olina okubanga dokita wo tomuteeka nnyo ku bunkenke. Bw'abanga takubuulidde gender y'omwana, tomanya maybe etteeka erifuga eddwaliro bayinza okubanga bakiteekawo nti tebakiriza kudisikasinga gender y'omwana. Oba nedda oyinza okusanga nga teyalabye bulungi oba scan teyalaze bulungi gender y'omwana, so aba tayagala kubanga ate akuwa results ezitali conclusive. Thank you for watching today's video, and I believe by the end of this video you now know that the best way to determine the gender of the growing baby is by doing what we call an ultrasound scan, specifically an obstetric ultrasound scan. Obanga obadde omaliza video yaffe eno, webale nnyo okubeera naffe, n'ekyo olina okumanya kiri nti engeri emu yokka gy'osobola okumanya gender ey'omwana kwe kubanga okola ultrasound scan oba ka TV. Webale nnyo okulaba video zaffe era kankulabe mu video eyenkya. Thank you for watching today's video. Let me see you in tomorrow's video and God bless. Bye bye. Sanyusa nnyo mukwano gwange okulaba ku video yaffe eno ya leero. Ngenda kuddamu ekibuuzo ku lwaki okyalemeddwa okubanga ofuna olubuto okoze buli kimu kyonna kyonna, scans ozikoze naye ng'ate okyalemeddwa okubanga ofuna olubuto. Leero bye tugenda okubanga twogerako. In this video today we are going to discuss what could be preventing you from getting pregnant. What could be preventing you from getting pregnant? We are going to talk about the anti-Mullerian hormone, and then we are going to talk about the follicle stimulating hormone. Tugenda kwogera ku hormones bbiri. Hormone esooka yeno gye tuyise anti-Mullerian hormone, and then hormone eyokubiri yeno gye tuyise follicle stimulating hormone. The anti-Mullerian hormone is basically a hormone which actually is released, and then it gives us a picture of how your ovaries are. It gives us a picture about the quality of your eggs. Are they really viable? Can they produce a dominant follicle or a dominant egg which could be fertilized on the 14th day? So mo video yaffe yaleero tuli kwogera ku hormone gye tuyise anti-Mullerian hormone. Anti-Mullerian hormone eno esobola otulaga amajigo gali gatya. Anti-Mullerian hormone eno nomo erina kubanga etandikira mu 7 paka ku 10 mu nsi ezimu esobola okubanga balaga nti erina okutandikira mu 7 paka ku 11. The normal levels of the anti-Mullerian hormone should be at least beginning from 7 onwards up to 10. If you do the fertility test, if you do the pregnancy test, and then it shows you that the anti-Mullerian hormonal levels are actually lower than 5, you are having an AMH level of 1, 1.2, 1.8, then it means that it is very low. It means your eggs are of low quality. You need medication to stimulate your eggs. Anti-Mullerian hormone test eno oba nga ogikoze ne results ne zivaayo ne ziraga nti AMH oba levels zino za AMH hormone eno gye tuyise AMH webanga eri wansi nnyo, then kiba kitegeeza nti oba weetaagisa treatment ng'eri targeted okubanga etereza hormones zo oba hormone eno gye tuyise AMH. We are also discussing about the second hormone known as the follicle stimulating hormone, FSH, follicle stimulating hormone. Tuli kwogera ku hormone eyokubiri gye tuyise AMH. Hormone eno, hormone gye tuyise follicle stimulating hormone oba FSH. Hormone eno ate nayo eplayinga kinene nnyo okulaba nti amajiga nagali okukula gakula bulungi, gabeere nga ate gasobola okubanga gawakisibwa oba gabeera fertilized ku lunaku olwa ovulation. The follicle stimulating hormone is normally released when a woman has just finished her periods, when the eggs are now beginning to grow. What stimulates these eggs to grow to become what we call a viable or a dominant follicle is what we call the FSH or the follicle stimulating hormone. Gwe mukwano gwange ayina ekibuuzo eyo olikwebuuza osobola otya okubanga ofuna olubuto, olikwebuuza okoze otya okubanga ofuna olubuto, neebuuzaako tulabe nga ate twogera ebisingako mu video yaffe eno oba nga tubukinze ku kliniki yange ne tutula wansi ne twogera. Give me a call today if you have any questions, and remember to support our work by donating. You can give your gift, just go below this video and then you'll be able to donate towards our work. We are looking at reaching many pregnant mothers with free ultrasound scans. A pregnant mother who does a free ultrasound scan and identifies what could be disturbing her or identifies a problem before giving birth, they could actually be treated very early, and we could end up saving a life. So join us by giving your gift. Jujukira nti tulina bye tuli okutambuza ebyokubanga kwegamba tutuukirira abakyala bangi nga tukola scans ez'obwereere, gezaako okulaba nga owaayo kyonna kyonna ky'oba osobodde, osobola okubanga odonatinga. Oba oyagala kuwaayo, wansi wano ewa video eno genda mu description box obeere ng'onyiga epeesa eryo, bajja kutwala ku page obeere nga ate owaayo kyonna kyonna ky'oba osobodde, ky'oba oweddeyo kyonna kyonna oba ky'oba otuwadde kyonna kye bayisa donation, tujja kuba tulaba nga tukikwatira wamu tufune scans ennyingi ennyo tusobola okutuukirira abakyala abali embuto, tubakoleko scans ez'obwereere. Beera bulungi, Omukama atukuume, kankulabe mu video ey'enkya. Thanks a lot for watching today's video. Let me see you in tomorrow's video. Have yourself a great day and God bless. Bye bye. Gezezaako okubanga ofuna olubuto naye ng'ate dokita wo akugambye nti olina kye tuyita unexplained infertility. Oli kwebuuza kino kitegeeza ki? Osobola otya okubanga ofuna olubuto amangu wadde bakugambye nti olina unexplained infertility? Mweno video tugenda kwogera ku butya osobola okubanga ofuna mangu olubuto wadde dokita wo akugambye nti olina unexplained infertility. Unexplained infertility kiba kitegeeza nti test zonna ozikoze ziri nomo. Okoze scan eraze nti amajigo gamala bulungi. Okoze tests eza hormones ziraze nti hormones zibalansinga bulungi. Then ogenze mu maaso okebedde omusulo era nago tests eza urine ziraze nti ziri nomo. Nekirala baawo naye akoze test gye tuyita semen analysis test naye ng'ate nayo eraze nti buli kimu kiri nomo. Okebedde buli kimu kyonna kiraga nti buli kimu kiri nomo naye ate okyalemeddwa okubanga ofuna olubuto. Kino kye tuyita unexplained infertility. Unexplained infertility osobola okugijjanjaba nga ogoberera instructions engenda okwogerako wano. Kyoba olina okukola olina okubanga okwatagana ne dokita wo kuba videos zino ze tukola ziba basically for information purposes only. Ziba za kubanga zikuwabula buli kibi olina okubanga okola okubanga ofuna olubuto amangu naye olina okukwatagana ne dokita wo gwe omukyala bakugambye nti olina unexplained infertility. Dokita wo ajja kuba akubuulira ekyokukola. Dokita wo ajja kuba akola kye tuyita IUI oba kye tuyita intrauterine insemination whereby bajja kukwata enkwaso ez'omusajja babere nga baziteekamu n'abaanayo. Then nekirala bajja kuba baboostinga oba bapriminga amajigo kye tuyita ovarian boosting. Ajja kuteekako eryo eddagala lyajja okusalawo dokita okusinziira ku ddagala ly'aba ayagadde. Dokita omu asobola okukozesa eddagala nga Clomid, dokita omulala asobola okukozesa ekika ekirala eky'eddagala nga ekya gonadotropins. So bino eddagala lyonna lyonna wabanga dokita walikuwadde obulungi n'enkwaso za bbaawo ne baziteekamu n'abaanayo nga bakozesa procedure gye tuyise IUI, osobolera ddala okubanga ofuna olubuto. Gwe ayagala okwogeramuko nange olina ebibuuzo byonna by'oyagala okubanga oneebuuzaako ku butya bw'osobola okubanga ofuna olubuto amangu, kuba ku namba zange ez'essimu 0701 79 78 76 eyokubiri eri 0787 668 962. Nkubiraako ojje. You started your periods on the 27th of January this year 2022 and you would like to know when are you going to ovulate. You started your periods on the 27th of January this year and you would like to know when are you going to ovulate. Well, I'm going to answer this question that has been asked by one of our viewers here on YouTube, that she got her menses on the 27th of January this year and she would like to know when is she going to ovulate. Yatandika periods ze nga 27 guno mwezi ogwa January, ayagala kumanya di lwagenda okubanga afulumya egi kye tuyita ovulation. Gerald Massa, the health educator, is the name of the channel. And remember, if it's your first time on our channel, on this channel we do create awareness about fertility and reproductive health. You started your periods on the 27th of January. You would like to know when are you going to ovulate. Ovulation is the release of a mature egg that happens on the 14th day from the first day you've seen your periods. So if you saw your periods today, 14 days from today, that's when you are going to ovulate, assuming that all factors are kept constant. If you have issues with your menses, if you have conditions like endometriosis, fibroids or leiomyomas, or even if you do have an ovarian dysfunctional disorder, then it means that your periods might actually become irregular. So if you are a lady and you are having irregular periods, this actually could be an indication that there's something happening with your hormones. But our friend started her periods on the 27th of January this year, and then she would like to know when she is going to ovulate. We said that ovulation is the 14th day from the first day you saw your period. So from 27th of January, when our friend saw her periods, we shall count and say 27th, 28th, 29th, 30th, 31st, 1st, 2nd, 3rd, 4th. Basically, that is now in Feb. So it means that if she saw her periods on the 27th of January this year, then we just simply count 14 days, and actually she is supposed to be ovulating, or she ovulated on the 9th of February. I hope this question has been answered. One of our viewers asked a question, and she said that she saw her menses on the 27th of January, and we actually were counting her menstrual, or we are counting her ovulation day when she is most likely to get pregnant. And we have said that if she ovulated on the 27th of January, if she saw her menses on the 27th of January, then it means she ovulated on the 9th of February. And since already we've passed that date of 9th of February, you should not worry. You should not actually feel despaired and lose interest that you will not actually get pregnant. You can get pregnant again. All you need to do is actually begin afresh. Wait for the next period and then count afresh. Still, the first day you saw your periods, take it as day 1, and then of course count 14 days. On the 14th day, that's when you are most likely going to ovulate, and that's when the chances of getting pregnant are very high. But remember, even the 3 days leading to the day of ovulation actually play a big part. Your chances of getting pregnant will increase. Talk to me on my WhatsApp if you do have any questions about fertility, and of course, stay blessed. May God bless us all. Bye-bye. Thanks for watching today's video. See you in my next video tomorrow, and bye-bye. Take care. You saw your periods on Feb, the 8th of Feb, and then you would like to know, when are you going to ovulate? Ovulation is the release of a mature egg on the 14th day from the first day when you saw your periods. Taking this formula into account and assuming that your periods are regular, you are on a 24 menstrual cycle, or you are on 28th menstrual cycle, and everything has been regular, you are not having any issues with your periods, then we shall use this method of counting 14 days. But remember, if your periods are irregular, then there's a different method we can use. She saw her periods on Feb 8th, and then she's asking, when is she going to ovulate? In other words, when is she going to be releasing the mature egg, also known as a dominant follicle? Or when are her chances of getting pregnant at the highest? If she saw her periods on Feb 8th, we shall say that we shall take the 8th, okay? We shall say that day you see your periods it's the day we say it is day 1, okay? So if you see your periods, for example, today is a Saturday, and you see you've seen your periods today, and then tomorrow you'll see your periods again. The next day you'll see your periods. The first day you see your periods is always the first day. We call it day 1, and taking this into consideration, our friend saw her periods on Feb 8th, so we shall say that 9th is the second day, 10th is the third day. We shall count on 11, 12, 13, 14, up to 21st, okay? Up to 21st of Feb. From Feb 8th, okay? From the 8th of Feb, when she saw her periods, up to the 21st day of February, okay? In other words, when you begin from 8 up to 21, okay? So 8 up to 21 days. In between, from 8th up to day 21, that is actually the day 21 is actually is what we call the ovulation day. In a nutshell, if our friend saw her periods, or if you saw your periods beginning from 8th, we just add 14 days to the day you saw your periods, and then we shall get the days, and this is basically from 8th we count 14 days, and then when we count 14 days we shall end up with 21 being the day of ovulation. So our friend, you asked this question, I hope you've got your answer. You saw your periods on Feb 8th, we counted from 8th, we said 9, 10 like that up to 21, and we said that on the 21st day, that is when you are most likely going to ovulate. And of course today is a Saturday, and today is the Saturday, and today is the 19th of Feb. So it means that from today, I think roughly some few days up to 21, on the 21st day, that's when you are going to be ovulating. Now, if you are looking at increasing your chances of getting pregnant, it's always very, very important that you actually utilize even the 3 days leading to the 14th day. In other words, from 21, count 3 days backwards, and we shall say 21, and then you go backwards and you say 20th, we say 19th, and then we say 18th. Okay, so beginning from the 18th day up to the 21st day, that's actually when your chances of getting pregnant are very, very high. So if you do have any other questions, let me know. And remember, on this channel we do talk about fertility. We do also create awareness about ultrasound scans. If you have done an ultrasound scan and then you are actually not understanding the results very well, you can kindly come to our WhatsApp numbers just down here, and then connect with me, and I will interpret your reports and then advise accordingly. Remember, self-medication is not good, so always follow what your doctor tells you. And of course, if you feel unwell, do not sit at home. Always go to hospital, talk to the doctors. They will advise you on what to do. Gerald Massa, the Health Educator, is the name of the channel, and I thank you for attending today's live session, today's video lesson about fertility, calculating the ovulation day for our friend who started her periods on Feb 8th, and we said that when we count from Feb 8th, the day she's going to ovulate is actually the 21st day. So if you also have a question out there and you would like me to answer your question, just go to the comments and ask your question. I will be able to answer. I will translate this video for our viewers who understand Luganda also. And tubadde tuli kwogera ku ekibuuzo ekyabuuziddwa omu ku baviewers baffe, era yabuuzizza ekibuuzo n'agamba nti Dokita yalaba periods ze nga 8 omwezi ogwokubiri, naye ate okuva kolo ayagala kumanya ddi lwagenda okuba nga ovulatinga, oba wetuba twogedde ku ovulation mu Luganda kiba kitegeeza eggi weivaayo okuba nga lisisinkana enkwaso ez'omusajja. So tugambye nti wetuba tubaze okuva ku lunaku lwe yalaba periods ze, obala n'ogamba nti Feb nga 8, Feb nga 9, nga 10, nga 12, niweyongera bwotyo n'obala ennaku 14. Olunaku lwe-14 lwe tuyita the day of ovulation, oba lwe lunaku eggi lwe ligenda okuvaayo okusisinkana enkwaso ez'omusajja. So obanga obadde oyagala kumanya ddi lw'ogenda okuba nga ovulatinga, walaba periods zo zatandika nga 8 omwezi ogwokubiri, kiba kitegeeza nga 21 omwezi ogwokubiri lw'ogenda okuba nga ovulatinga. Leero tuli nga leero 6 nga 19, so kiba kitegeeza nnaku ntini nnyo ojja kuba ogenda mu ovulation yo. Increasing oba okwongeza chances zo ez'okufuna olubuto, kyandibadde kirungi n'oba nga ospendinga more time with your partner. Spend more time with your partner, and also remember to manage stress. If you can actually also avoid stressors. Why do I talk about stress and stressors? Because we are living in a stressful world, okay? But you choose what you attract. You choose what you will put your focus on. If you put your focus on negative thoughts and you surround yourself with negative-minded people, then it means whatever will be coming into your life will be negative. So you can actually choose to make a turnaround, and then you actually begin associating yourself with positive-minded people who really believe and pray to God and believe that things will be fine. So if you are looking at getting pregnant, you are a couple, you've tried to get pregnant and things are not working out, remember one thing, my friend: there's only one person who is above us all, and that is God. You can listen to us, the experts, you can talk to your doctors, you can actually do all your own research, but the most important thing you need to take from this video is that God is above everything. God is above infertility. God is above divorce. God is above disease, and God is above cancer. So I would really say, if you are looking at what should you do, you've done everything, you've taken all the drugs you've been advised, it's high time you put your trust in God. Follow what the experts tell you, follow what the doctors advise you, but remember to kneel down and pray. Read your Bible. If you are a Muslim, read your Quran and pray to Allah. And one thing you have to know is that when we move closer to God, God moves closer to us. So make sure that you put God first and then follow what the experts tell you. Believe in your heart that you will get pregnant. If you have tried for a long time, believe in your heart that you will get pregnant. Put God first, and by the grace of God, I believe everything will be fine. Thanks for attending today's video lesson. See you in my next video tomorrow. I'll be waiting for you. Have a nice evening, have a nice day, and greetings. Bye-bye. Ovulation is the release of a mature egg on the 14th day from the first day when you saw your periods. Taking this formula into account and assuming that your periods are regular, you are on a 24 menstrual cycle, or you are on 28th menstrual cycle, and everything has been regular, you are not having any issues with your periods, then we shall use this method of counting 14 days. But what are the causes of a missed period? Tugenda kudamu ekibuuzo ekibuuziddwa kuba viewers baffe nga abuuza nti biki ebiviirako omukyala okubanga amissinga periods ze, biki ebiviirako omukyala okubanga amissinga periods ze. Gerald Massa, the health educator, is the name of the channel, and if it's your first time on our channel, remember to subscribe so that you do not miss new videos we release every day. Missed period, what are the causes? So if you are expecting to see your periods today and then you do not see your periods, the first thing which will come on your mind is you could be pregnant as a woman. Remember, on this channel we do create awareness about fertility and reproductive health. So if you miss your periods, it could be that you are pregnant. Oba omisinze periods zo guno omwezi, oba obadde olina okulaba periods zo leero naye n'ozimisinga, kiyinza okubanga kitegeeza nti wandibanga wafunye olubuto. The next cause of a missed period is you could be having imbalances in your hormones. When we talk about hormones, these are the chemical messengers of your body. You as a woman are born with specific hormones. For example, there's the follicle stimulating hormone, also abbreviated as FSH. This plays a big role in stimulating your follicles or your eggs so that they do grow, and then it can be fertilized. A mature egg is known as a dominant follicle. On the 14th day, it can be fertilized to become a baby, to become an embryo. Tugambye nti ekyokubiri ekisobola okubanga kiviiriddeko okubanga toli kulaba periods zo, kiyinza okubanga olina kye tuyita hormonal imbalance. Tugambye nti ekisooka wandibanga wafunye olubuto. Ekyokubiri oyinza okubanga olina kye tuyita hormonal imbalance. The next cause of you missing your periods is that you could be having disease of the womb, disease of the uterus. For example, you could be having fibroids, you could be having actually cysts or even ovarian cysts. These are swellings on your ovaries. They interfere with how your ovaries are going to function. Your ovaries become what we call dysfunctional. Tugambye nti ekirala ekisobola okuviirako obuzibu buno kwe kubanga wandibanga olina ekirwadde ekyanabaana ekiviiriddeko okubanga amajigo tegakola bulungi, ekiviiriddeko okubanga nabaanayo teri kufunctioninga bulungi. Because for you to see your periods, actually your hormones should be balancing. The hormones we talk about on our channel here include the follicle stimulating hormone, which is responsible for your eggs, and then also the progesterone hormone and then also estrogen. So if these are not balancing, then you could actually have issues with your period. So if you have missed your periods, all you need to do right now is do a pregnancy test. You could do the urine HCG pregnancy test, where you'll get the heuristic, which will actually be used to test your urine, and then you could also do the serum HCG pregnancy test, and lastly you could think about doing a pelvic ultrasound scan. Let me answer all your questions on my WhatsApp numbers. They are just across this video, and remember to have yourself a great day. See you in my next video tomorrow. Thanks for watching. If you've watched this video up to this far, thanks for watching, and see you in my next video tomorrow. Bye bye.